My name is Katie Harron. I'm a Professor of Statistics and Health Data Science at the UCL Institute of Child Health, and I use national population-based datasets to try to generate evidence that will improve services for children and families. The most exciting research that I'm working on at the moment is a project called ECHILD, which links together data from hospitals and schools for all children who were born in England. We work here at the UCL Institute of Child Health, which is connected to Great Ormond Street Hospital, and we work in a large mixed team that includes data scientists, statisticians, epidemiologists and clinicians. Every time any one of us goes to the GP or goes to A&E for a broken arm or sits an exam at school, a record is made, and those records are used to help organisations fulfil their day-to-day roles. But when we bring all of that data together, it covers such a large proportion of the population that it's a really valuable resource for research. This sort of data research is really relevant to new families because we're using information from the services that new families access in order to improve those services. So, for example, linking information from hospitals about children who are born too early with later educational data helps us to have a deeper understanding of the needs of preterm babies and how we can support them in their early years. So that's an example that's quite close to my heart because I had a daughter at 28 weeks of gestation, so I was 3 months before my due date. And at the time I was obviously concerned about what her immediate health conditions were, but I also found myself thinking a lot about what the future might hold as she grew older and started to get ready for school. I think COVID really highlighted the need for accurate data to inform how the NHS responds to the needs of the population. So I think new families should be interested in this area because the legacy that the pandemic left in terms of the increased data sharing means that these data will continue to be used to inform how services are delivered to children and young families, particularly when we think about health, education and children's social care data. We're in a really unique position where we're starting to open up new data resources to generate evidence that's really highly relevant to large proportions of the population.